Avascular necrosis of the femoral head, also called ischemic necrosis or aseptic necrosis, happens when the blood supply to the top part of the thigh bone is cut off or damaged, causing the bone tissue to die from lack of blood. Globally, there are an estimated 200,000 to 500,000 new cases every year, and over 10 million people are living with this condition, many of whom need some form of treatment. For early-stage patients, those with small lesions in stage I or II on X-ray, minimally invasive surgery is the recommended conservative approach. One common procedure is core decompression with autologous bone grafting, which clinical data shows has a success rate of over 80%. This surgery significantly improves the patient's condition, delays the need for joint replacement, and reduces the financial burden. Step 1. Insert the guide pin. Align it with the femoral neck through the surgical incision. Keep the direction steady and drive it in until it's about 5 millimeters from the surface of the femoral head. Step 2. Place the protective sleeve through the positioning hole down to the cortical bone at the incision. Then insert a cannulated drill over the guide pin. Attach the drill handle and rotate to open a channel through the cortical bone. Step 3. Remove the cannulated drill and take out the trephine. Pass the trephine over the guide pin. Attach the handle and advance it to the necrotic area, stopping about 3 millimeters from the edge of the lesion. Keep the cancellous bone core, then use the cannulated drill again to go down to the tip of the guide pin. Step 4. Insert the decompression knife through the established channel to the predetermined position. Turn the adjustment dial on the handle to the appropriate setting, then rotate the blade to remove the diseased bone tissue. Step 5. Use a pulse irrigator to wash out the decompression channel and the area where the lesion was removed. Step 6. After irrigation, take the autologous bone that was previously harvested with the trephine and pack it firmly into the lesion area through the trephine. The decompression channel can also be filled with a vascularized bone flap or artificial bone graft. Step 7. Irrigate and close the surgical incision with sutures.